Hi guys, Rory here, joined by Ellen Buckley. Ellen's a local physio. She's actually my physio, so helping me get some of my little niggles ironed out. But what we've certainly found at Fit Family is that after about 4 weeks or so, people start getting niggles, and a lot of our trainers need to know how to deal with those, and so do you as a member. So I've been talking to Ellen. She's kindly agreed to run through some of her methods and to help you continue your training. So thank you so much, Ellen, for your time. We appreciate it. No worries. So Ellen, you've been a physio for a couple of years now, and you specifically have an interest in sports physio, is that right?
Yeah, definitely. So I've been working for just over 18 months. The main part of physio that I really enjoy is helping people who've started on lifestyle change, helping them maintain those benefits. So things like people who've gone back to sport after a long break off, often they'll get injuries at the start, and I'm really keen on helping them to maintain those positive changes that they've made.
Great. And you've got a little system that you use, so a traffic light system. Do you want to run us through that?
Yeah, sure. So there's green light pain, amber light pain and red light pain. So green light pain is normal pain that you get after training, so you get a little bit sore for a couple of days in your muscles. That's totally normal pain. It's all
Told you, it's not just me. So
it's all right to train through that pain. I've definitely experienced that pain a little bit in my sessions with Rory. Red light pain is any pain in your back or in your neck, so that's a sign that you need to stop what you're doing straight away. Also any sudden sharp pain that you get with your training. Amber light pain is a little bit more difficult, so it's any joint pain that you get more than 5 minutes into the session, so after the warm-up, and also any recurrence of any old injury that you've had. So that's normally a sign that you need to stop, get the trainer to have a look at what you're doing, and if it stays around for any longer than a couple of weeks, get it checked out by someone.
Okay, so just to recap that, so you've got green light pain is normal, so delayed onset muscle soreness, or just niggles that you'd have restarting an exercise program, but they certainly will go away or get
definitely.
Better. Amber light is something that the trainer can maybe help with in the first instance, so absolutely, we're your resource in the first instance. And then red light pain is
just stop and get it checked out by someone else. Yeah.
Fantastic. Well, thank you. So we find quite often, that 4-week mark is quite critical for a lot of our members, and if you're looking at this, that might certainly be the case for you. So what would your advice be for someone who's around that mark, who started and now they're sort of, I suppose, ramping up their training perhaps, or starting to get niggles?
Yeah, so 4 weeks is definitely crunch time. It's a time when a lot of people start to get overuse injuries, so things like shin splints, plantar fasciitis tend to come on around 4 weeks. So it's a really important time to get injuries checked out, because they can then just snowball and you lose all the benefits of the training that you've had so far. So it's really important to do a proper warm-up, make sure you're stretching really thoroughly after training, and just let the trainer know about any pain that you're getting, have them check your technique, because often you can just do small changes with technique, make a big difference, and just make sure you're wearing proper shoes when you're exercising. So you've got to have good quality runners, and make sure that they're appropriate to your foot type as well.
Great. Okay. So if any of our members need to go see a physio, obviously there's yourself as a great local resource, but people watching this will be not necessarily local. So how do you find a great physio?
So if you've been to the physio, you should have a good idea of what's going on, definitely within 2 sessions, and you should have a plan for getting back to sport or getting back to Fit Family training. And also generally a good physio will give you exercises to do so you can help the rehab process yourself and you're not just reliant on someone else to do that for you. But it's each to their own, so if you find someone who works for you, definitely stick with them.
Great, thank you. So something that I do that I enjoy as a part of my training, that I encourage a lot of my members to do, you guys to do, is Pilates. Now I know you've got an interest in Pilates, and specifically clinical Pilates, and we're on the reformer bed now. Do you want to run us through where you see Pilates fitting into an exercise program and the benefits of it?
Yeah, sure. So a lot of the time, people who come back to exercise after a big break won't have great form, won't have great posture a lot of the time, and won't have a strong core. So sometimes the injuries that you develop can be prevented if you develop your your core muscles in the first place. So if you've got Pilates going as part of your exercise program, you can prevent some of those injuries. It's also really good for rehab for injuries as well. So if you have to take a little bit of time off exercise, coming back, having a strong core can stop you from getting those injuries again. And it can also just improve your performance. So if you've got a stronger core, you can do more squats, you can do harder arm exercises because you've got a stable base. So what Pilates is all about is just doing kind of light exercises, but focusing a lot on your technique and on your posture as you're doing it to make sure you're recruiting the right muscles and you're not as at a high risk of injury.
Absolutely. Yeah, it's maybe a bit of useless trivia, but it's Pilates is all about control, and actually was called controlology, and that's what it originally was called. And it certainly gives you that control over your body through starting at the core. So I certainly miss it if I miss a session. I miss that out of my training for the week. So I encourage people to do that. There's clinical Pilates, there's mat Pilates, which we you may know have a couple of classes, but doing different things. They've got different focuses, but they're both great for your form and technique and control. So Ellen, what do you like doing? What's your exercise? That's sort of a bit of a loaded question because I know a bit of it, but what do you like doing yourself?
Well, I play netball twice a week. I do one personal training session and one group fit family session, and I do Bikram yoga twice a week as well. So getting some of that stability, flexibility stuff in there as well, which is important, some of the higher intensity stuff with Rory. And just mixing it up is really important. So if you're doing 6 sessions of the same thing every week, you're going to get injured and you're going to get bored. So it's important to get some variability in there.
Absolutely. Yeah. Well, thank you very much, Ellen. That's great. And look, folks, if you need some advice, Ellen has very kindly offered. If you're at a session and Ellen's there and she does pop in, she can have a look at some of your niggles or some of your concerns. Come and see her. We'll pop up her contact details on the video there. But if Ellen's not convenient to you, there's plenty of physios out there. Just find a good one. But thanks for watching. Cheers. Thanks, Ellen.